My name is Meredith Dammers, and I'm going to talk to you today a little bit about an organizational issue that my group and I observed in the workplace, which is medication administration errors. I've given you some facts here in regards to medication administration errors. This is a patient safety issue where the nurse as well as advanced practice nurse are one of the first lines of defense in preventing these errors from occurring. Drug administration is a vital action in the care and safety of patients. So there are multiple contributing factors to medication administration errors. One would be medication packaging. Another would be poor communication with the provider, whether it's verbal orders, clarification of a handwritten order, which doesn't happen as often anymore, miscommunication with the provider, or failure to alert the nurse to a prescription change. Then there are pharmacy processes, which actually have a very low percentage for errors, medication administration errors. There are staffing issues, which includes higher patient-staff ratios, nurses having to float to other units they're not familiar with, interruptions during medication administration, and nurses not following the medication administration guidelines. And then, of course, there's the knowledge deficit of the nurse administering the medication. I just wanted to include this slide to review the 10 rights of medication administration, which helps to reduce the overall medication administration errors. So I'm not going to read off this slide because there is a lot here, but just the takeaways are that there is that direct link between nurse managers' activities, job satisfaction, and medication administration errors. So basically, if a nurse felt safe and comfortable and happy in their job, there were less medication administration errors. Those units that facilitated a very strong patient safety culture had lower adverse effects. Those units that had organizational learning, continuous improvement, non-punitive responses to errors, open communication, and nurses feeling safe reporting a medication administration error. Now I'm just going to speak briefly on the impact of interprofessional teams and communication. We've already discussed how poor communication with providers is a contributing factor to medication administration errors. Now the reporting of these errors is also important to help prevent further adverse events and to learn from the mistakes that were made. Collaborative pharmaceutical care includes two main factors: medication reconciliation, which is mostly completed by the nursing staff, and then medication review, which is initiated by the pharmacist but is a multidisciplinary effort. It improves adherence and it reduces drug-related problems overall.
Hello, this is Chiquita Anderson. I will be discussing the impact of informatics. The integration of nursing science along with technology has been shown to reduce medication errors and improve medication administration safety. Listed below are a few key points. This slide highlights evidence-based medication safety and interventions that have aided in the reduction of medication errors. For example, pre-filled syringes, barcode-assisted medication administration, automated dispensing systems, nursing education programs, preventative intervention programs with protocols, and pharmacist-assisted supervision and support. Rogers' 5-step change theory. The first phase is knowledge, which just represents exposure to the new idea. The second phase is persuasion. The individual is just interested in the idea and seeks more information. The third phase is decision, in which the individual just weighs the value of the idea and decides whether or not to adopt the change. The fourth phase is implementation, in which the individual takes up the idea and puts the plan into action. The fifth phase is confirmation. Basically, the individual resolves their own personal decisions and just continues moving forward with the new innovation.
Hello, my name is Sloane Herring, and I will be discussing a few topics regarding medication errors. I'm going to start out with ethical considerations. As you can see on the slide, there are several that can impact care. All of these terms play a major role when medication error occurs. If a medication error occurs, the healthcare provider should inform the patient of the error and any possible side effects they may experience. Doing this can, in return, allow the patient to make an informed decision of how they would like to proceed with their care. The British Journal of Nursing provided a study on the HALT model and its impact on reduction of medication errors. The different aspects of this model include hungry, which can be emotional or physical, angry, which can be seen with high levels of stress one may be dealing with. Third is late or lonely. You may be running late for work, which can be a very stressful event. Lonely can be seen when you are completing a task and you might ask yourself, should someone be checking behind me or working alongside me on this task? The last is tired. Are you getting plenty of uninterrupted sleep at night and allowing yourself mental breaks throughout the day for your mind to rest? This model can help one understand the emotions they are feeling and be able to take the appropriate steps to avoid a potential error. The 4 topics discussed on this slide are all ways which the APRN can be involved in resolving the rise of medication errors. First, as discussed by Chiquita, the steps of Rogers' 5 phases to change can be used to better understand if the APRN is ready to accept or implement change. As discussed by Meredith, the APRN should follow the 10 rights of medication administration when prescribing medications. By following these rights, several steps are completed that can help prevent a potential error. Third, communication, also previously explained, can be a vital aspect when completing medication orders. Handwritten and verbal orders can be transcribed incorrectly, which can lead to a potential medication error. By utilizing the L in HALT model, the APRN can determine if a second check would be beneficial before submitting a medication order. Fourth, the HALT model can be utilized by the APRN to help them identify any areas physically or emotionally that may be impacting the care of their patients or that are contributing to medication errors. In summary, medication errors are a major issue found in the workplace and will only continue to rise unless steps are taken to resolve the matter at hand. By understanding the many factors which contribute to this problem, our group was able to discover ways to promote change and potentially decrease these errors. We determined this can be achieved through the use of Rogers' 5 phases to change, 10 rights of medication administration, good communication, and the implementation of the HALT model. Thank you for your time.